Hey everyone, I'm Dallas Goldtooth here with the Indigenous Rising Media as a project of Indigenous Environmental Network, and I am so happy to have this conversation. This is a first in a series of conversations that we would like to have with a number of folks who are on the front lines in various ways, supporting Indigenous communities, helping Indigenous communities fight COVID-19 in Indian country. And this conversation and series of them will predominantly focus on communities within so-called United States, but then also there's of course overlap with some of our brothers and sisters north of the Medicine Line in so-called Canada. And so there's a lot of this discussion will focus on a lot of issues that both, whether you're on the north side of the Medicine Line or the south side, might be relevant to you. I'm Dakota and Dene, and I am just, I'm a father of 5, and I've been very worried about all the stuff that's happening in the world, and I thought that this is a great opportunity for us to have sincere and direct conversation with some important people who are leading this fight or who are contributing to this fight to protect our communities. And I just want to say, I guess legal terms like this is our opportunity to have conversation about information, but nowhere near is the stuff that's shared here is IEN prescribing people to do it. This is just merely sharing information based on people's professional experiences. And so if that's that, I want to jump right into it and kind of introduce our guests here at this time. And we have also, I also want to introduce on the back end of this video, or on this webinar, my coworker, my collaborator, Jennifer Falcon, who is our communications coordinator at the Indigenous Environmental Network, is with us, and she'll be monitoring the questions on Facebook. And at the end of halfway through this conversation, we're going to take some of those questions, and Jennifer will be helping us in that. So I want to introduce our relatives who are here. We have Nicole Redvers, Linda Black Elk, and Stacy Bolin. And we'll just go down the line. Stacy, can you hear us? How's your sound going?
I can hear you. Can you hear me?
Yes, we got you. Thank you. All right.
For those that don't know,
if you don't know, we've been having issues with sound, and we got ourselves up and running. So just want to ask you all to introduce yourself, where you're calling from, and kind of what's your part to play at this very moment in fighting COVID-19 and helping Indian country. I guess just keep it short introductions, and we'll go into the conversation after that. So I'll start with Stacy, and then we'll go on down the line to Nicole and Linda. So Stacy, take it away. Just introduce yourself.
Thank you. Thank you very much. Anin Gijikot Miknikwe. My name is Stacy Bolin. My native name is Turtle Woman. I am the CEO of the National Indian Health Board in Washington, D.C., and I'm an enrolled member and a citizen of the Sault Ste. Marie Tribe of Chippewa Indians in Michigan. And in my role as CEO of the National Indian Health Board, I and our organization, our leaders, are sort of on the front lines of advocacy, getting information to the tribes, ensuring that the tribal voices are heard for what is needed, and doing surveys and national calls and webinars and so forth out to Indian country to make sure we're getting their message right and that their voice is heard in the way they want it to be heard.
Thank you. We'll go over to Nicole. I'm so happy you're here, Nicole.
Wow, Masicho, thank you. Tanatea. Hello, everyone. My name is Nicole Redvers. I'm here right now from Grand Forks, North Dakota, but I am a member of the Dene First Nation up in Dene country in Northern Canada. I'm currently an assistant professor in the Department of Family and Community Medicine here at the University of North Dakota, and also working with the Indians into Medicine program, as well as the Department of Public Health here at UND. Also lastly, the board chair of the Arctic Indigenous Wellness Foundation, with mandate of merging conventional and traditional forms of medicine. And very happy to be here. It's an important topic, and I think we're going to have a lot of good conversation coming. Masicho, thank you.
We'll go over to Linda.
Hi everybody. This is Linda Black Elk. I am from the Catawba Nation. I'm also Korean and Mongolian, part of the Duka people from Northern Mongolia in the Darhad Valley. And I'm super happy to be here to talk to you guys about traditional medicine, some stuff that I've been doing and recommending to friends and relatives who, some of whom have actually come down with COVID-19 and some of whom are just more concerned with prevention. Yeah, I'm an ethnobotanist and that's my perspective. Oh, and I teach at United Tribes Technical College in Bismarck now.
Thank you to each and every one of you for being a part of this conversation. Thank you for those who are watching. Please share this this video, this conversation right now, so other folks can get information about the current crisis that we're facing. We wanted to have this conversation to really just help, one, disseminate misinformation. You know, I think that social media is a powerful thing, especially in Indian country. Everybody, you know, it's a main way how it's a primary way that Indian country communicates. But then also we have to deal with a lot of misinformation. So our intention here is to help maybe disseminate proper information, accurate information about what this virus is, how it's affecting our communities, and how are we responding to this crisis. And not only that, but also what do we need to respond to this crisis? What are some of the needs in Indian country? And so the three guests here are a part of that conversation. So to start the ball rolling, I want to go to Nicole. Nicole is a physician and has been doing great work at the school at UND. And I want to ask Nicole if you can give us what is COVID-19 and like really how, and not only that, but also how is it transmitted? Because I think there's a lot of conflicting accounts, and I know that some of it, I understand, like some people say we don't know, and some people say we do. So what say you?
Absolutely. So the COVID-19 is the disease that we've been hearing about throughout all of our media, but it's actually caused by a virus that has the name of SARS-CoV-2. So the COVID-19 is actually the name given to the disease presentation that we see that comes from patients that are infected with this particular virus. From what we know right now, the virus is spread through tiny droplets coming out of the nose or mouth of infected people, usually when they cough or sneeze. There has been some evidence that there may be some fecal or poop transmission as well, although there's not a lot known about that at this time. One of the unique things about this virus is it does seem to survive on certain surfaces for certain periods of time. So far, the studies have been showing about 24 hours on cardboard, about 2 to 3 days on stainless steel or hard plastics. And then airborne for about 3 hours or so under controlled conditions. So what that means is those are in laboratory settings, which means they may be different out in the public and in our environments. Because it's such a fluid situation, a lot of this knowledge is coming on the fly, and we haven't had many months and years to be able to gather data to be 100% confident about some of the transmission routes. However, we're fairly confident that air droplets are the main spread. And it's one of the reasons why we see a lot of the public health recommendations being ensuring that you're coughing, obviously not on your hands, sneezing in your hands, washing your hands a lot, reducing touching of the face. All of this really is to reduce any contact with virus that might have occurred from, say, a doorknob or something else, and then placing the virus close to some of the orifices like the mouth or the nose, which could risk potential infection.
What I think I'm saying like what is obvious, but what are the special risks when it pertains to Native communities? You know, what is the risk here for Native communities as we're kind of exploring mitigation efforts?
So our main risk right now is our elderly population. A lot of the complications start to rise over the age of 60, and they start to rise substantially between the ages of 70 and 90 years old. It's one of the theories ongoing about why we have such high rates in Italy right now, because they do have an older population on average. So my big concern right now is for our elders within the Native communities, because we have a lot of sacred knowledge holders that are living still on reservation in areas. The other concern that we have, as everybody knows in Indian country down here in the US, is our IHS systems are significantly underfunded on a good day, pending the state of operation. So this is a big concern in terms of ensuring that there's enough resources to be able to handle the complication rate that is expected within this presentation of disease. Last I heard 2 days ago, and perhaps Stacy can update on this, is the over $8 billion that was promised. There was about 40 million that was put aside for tribal communities and also urban centers. As of 2 days ago, at least urban centers had not received any of that funding, which means there's a substantial delay in the gathering of resources to be able to adequately deal with the coming crisis within particularly our urban communities. We know that obviously 60% of our Indigenous people are in urban communities. So that's a concern. Lastly, some of our basic public health measures, such as washing hands, are a huge issue on some reservations. Just under 60 out of 1,000 of our Native homes in the US do not have adequate plumbing, comparatively to 3 out of 1,000 households that are non-Native. So just to be able to wash hands adequately becomes a challenge in those environments. We also have a lot of overcrowding with sometimes 2 or 3 families living within one environment. And this is one of the reasons why we had such an issue with the tuberculosis epidemics, in the previous century, is because of the close contact of living that people have just due to the socioeconomic circumstances within those areas.
Thank you, Nicole, and it was a good segue. I want to go over to Stacy. Stacy Boland is the CEO of the National Indian Health Board. Stacy is on the call via phone and also video, so you may not see the image. Maybe Jennifer, if you can go back to the gallery view, we could see her while she gives her report. Nicole had mentioned funding. I mean, it sounds like a huge issue. IHS, Indian Health Service, has always been underfunded. A lot of communities have been in dire need for support, and now we're faced with this pandemic, and there's a shortage of supplies across the country and across the world. And so your organization is based in Washington, D.C. Is in direct communication with a lot of communities, a lot of physicians, a lot of people who are on the front lines trying to stop this or trying to mitigate the spread of this virus. Where are we at, and what is happening right now in Washington, D.C. as far as efforts to get resources out, and what are the needs from what you are hearing at the National Indian Health Board?
Thanks for inviting me to speak to this. Nicole gave a very good briefing and very accurate briefing about what we're facing right now, and I believe it was March 8th, the first supplemental package went through Congress. We were successful in getting $40 million set aside for the tribes, specifically to fight COVID-19 and to prepare for COVID-19. There are some nuances legislatively that occurred that is making it very difficult for the tribes to get the money the way they want to get the money. And that is, there was a White House call the Thursday. This bill was signed on Saturday before last. There's a White House call that Thursday talking about preparation and so forth and what was being done. We held an all tribes call just after that and had about 600 people on the call. And the purpose of the call was to try to get our finger on the pulse of Indian country to see what are you experiencing, what do you need. We have this $40 million that is going to be signed into law in hours. How do you want to receive the money? And the messaging was uniform that the tribes wanted to receive the money through the Indian Health Service because the Indian Health Service has the greatest familiarity, flexibility, and methods of getting funding to Indian country quickly. And the Indian Self-Determination and Educational Assistance Act is in full bloom in the Indian Health Service. So the self-governance, contracting, and compacting tribes to get that money very quickly and use it exactly how they need to use it. So because the way the appropriations work, the money was targeted to go into the Centers for Disease Control and Prevention. They are not as familiar with tribes. They don't have the cultural competency in this regard that tribes do. And they don't have the economic, the financial bridges, if you will, to get that money out quickly. Tribes were adamant they did not want to have competitive grant process. They did not want to have onerous administrative burdens on this funding, all the things that IHS knows how to do well to prevent those things. We can't get the money into the Indian Health Service. I also want to say that the money was a baseline. It's not the tribes are getting 40 million. In fact, something was signed today, supplement number two, that I think it's 86 million is going into the Indian Health Service directly. And there's construction funds, facilities, enhancement funds that are tied to that funding as well. But the 40 million original, it's not out the door yet. And we can't get a straight answer on how to get it. But we're pounding on it every day.
If I may jump in, for folks to understand, and this is as I understand it, Congress has been talking about ways to help American citizens and the economy, and so they're coming up with these different stimulus packages. Stacey, you've already mentioned one and two, and there's a current discussion right now for a third stimulus package with the projection that there are going to be 4 and 5, a few more stimulus packages to help. And the National Indian Health Board, your organization, is directly involved in trying to help ensure that within those packages, Indian country does not get left out, and that funding gets to where it needs to go, right?
Yes. In package number 3, we're asking for 1.5 billion to go to the tribes, specifically for healthcare, because that doesn't even touch how 70% of tribal communities, their income is relying on the hospitality industry. There's a whole additional workforce of experts from around the country. The National Congress of American Indians, the National Native Finance Officers Association is leading that effort. I am not as familiar with it, but I do know that those funds that the tribes raise to tribal enterprise, millions and millions of dollars of tribal money is used to help our health system. And when those economic forces are threatened, that only exacerbates the healthcare side as well.
Yeah, I know personally, I know a lot of Native folks in this country who are very, very worried, a lot of tribal leaders who are worried because their economies are based on tourism. Their economies may be based on, land usage, whatever, and people aren't going to be able to come out. Their economies are based on casinos. And so they're all being directly hit. And it seems like there's a request to say, hey, don't forget your obligation that you have to support tribal nations in these efforts. So thank you very much, Stacey, for giving us the overview on that. And I want to definitely come back to that. I think a lot of folks just don't know what's happening on the federal level. They don't know what's going on. And even tribal leaders are like scrambling to figure things out. So thank you for that. And we'll come back to you. I want to transition over to Linda Black Elk. Linda is an ethnobotanist. And Linda, you did a video last week, or I believe a couple of days ago, responding, kind of giving information of how, from your perspective, of how we can, address this crisis and folks can find usage of traditional medicine as a way to at least, cope with the potential symptoms, I believe. And you can correct me if I'm wrong, but we wanted to have this conversation, but we also were like, hey, we also want to have provide that space for a conversation around traditional medicine, and how does that play a role into us, mitigating the spread of the coronavirus. So Linda, if you want to explain a little bit more about that video and the purpose of it and kind of what you're hearing from folks in the past couple of weeks.
Sure. So the video that I made, it was sometime last week, was in response to some very, probably 400 panicked messages a day from patients of mine, from people that I work with, from, people, from friends of mine who were asking, what should I use? What can I use for prevention? What can I use if I actually get sick? Right. So those are two sort of different things. And, so that's why I put that video out. The thing is, we are finding new stuff out about SARS-CoV-2 and about, the infection COVID-19 every day. And I think it's important for people to remember that this is a new virus and this is a new disease. And it's presenting itself, sometimes we're surprised at what's happening with it. And so even I'll probably have to make a new video because things are changing so quickly. And but I stand by the recommendations that I made in the video. And I feel like right now is the perfect time and an important time for us to rely on traditional medicines, because a lot of medications that, prescription antivirals are not accessible to our Indigenous communities. They tend to be very expensive. I was actually at an IHS hospital yesterday asking about access to Tamiflu and things like that. And they said that they absolutely had no access to it unless I was over the age of 60 or 65. So, I think right now is the perfect time to rely on our traditional medicines. I think that especially in our urban, Indigenous urban communities are being hard hit because even traditional medicines, when they try to go get them at their local co-op or herb shop, they're prohibitively expensive. So, it's important to share and to talk about what's available, what's inexpensive, or what's free. And that's basically the reason that I've gotten so involved in that discussion.
I want to go over to Nicole. As a physician, I know, and you've done a great work, amazing work, but there's also that relationship between traditional medicine and quote unquote Western medicine. So do you have any comments or reflection on what Linda shared here, and also helping give people some good information about should they be feeling the symptoms of the coronavirus, or what is being projected as the symptoms? What can they do?
Absolutely.
What should they do? Are different options where you can word that, I guess.
It's such an important question, and it's sort of one of these instances where, Western medicine is not ahead of the game right now. There's still a lot of outstanding questions, just as Linda was talking about. One of the interesting pieces of data that we've just realized within the last day coming out of Italy is there's been a lot of talk about those with health complications tend to have more serious complications with the coronavirus disease. And what's been interesting is 75% of those co-health conditions have actually been hypertension, which is very odd because, hypertension you wouldn't expect if it was in a managed state to be an issue. So it's one of those unique things that happen with some of these viruses where we would expect maybe, pulmonary conditions or heart failure, but for whatever reason, it's hypertension. There is some thought that one of the hypertensive drugs, ACE inhibitors, may actually be part of that issue. So it's evolving so quickly right now. We just don't have the information, at least from the Western standpoint. There is ongoing clinical trials right now with a number of different antiviral drugs, in addition to chloroquine, which is actually a malarial drug. However, they are no close to having the answers. And just as Linda mentioned, a lot of these medications are just not accessible through the IHS clinics. From the traditional medicine standpoint, I think this is really important. And, having a conversation with one of my elders last week, who reminded me that this was prophesized decades ago within many of our communities. And I've heard stories from other elders as well that they knew that a sickness was coming at this time. And it was a sign that we were becoming imbalanced with the earth and how we are taking care of her. And the sickness would come to be able to ensure that we go back to the land and gain our relationship back. And what that means is utilizing and creating that relationship with land as a medicine place. And, being able to go back to those community-based ways, I think, are important. I've also been getting a lot of questions about medicines and what types of things can be utilized. We just have to be very clear that, we don't know. And even our ceremonial people, I've talked to a few that have went into ceremony to get a better idea about what the energy of this virus is, and to get a better clarity about what types of treatments might actually be most appropriate. However, the good news is a lot of our medicines have very general actions because many of our plants contain hundreds of properties within them. And whether or not it's through smudge, we know that there's data that shows that smudging can act as an antimicrobial within the air around us. So things like that, exist. It may not be specific to COVID, but if it's not going to hurt us and if it's going to help clear the air, then I don't think there's any harm in using these types of agents. We have many antiviral plants. We also have plants high in vitamin C, for example, things like chokeberry and cherry and cranberries and all of those things. And we know that vitamin C is good for increasing our immune system. Marrow, bone broths, are very immune stimulating as well. And most of us, even on some reservations, will have access to some of these things if we share, and give back to our communities. The last thing I want to note, one of my concerns throughout this virus has been the amount of pressure on our medicine people, because you can imagine that a lot of people are very worried and they're contacting their traditional healers and their medicine people. And we just need to be cautious as a community as well, not to overburden them, overwhelm them, but also expose them. And I've seen some elders, go into containment and only do consults through phone, and do bag drops, of medicines outside of their homes. So I just also ask people to just be thinking about our elders and ensuring that if we are asking them for knowledge, that we're also supporting and helping and ensuring that we're not overburdening them or exposing them with multiple visits from community members, that we really need to be protecting them as much as we can right now.
Yeah, I think that's a great point that you bring up, Nicole. There's so many things that I think of when I'm hearing you talk that really resonate and also lead to other questions or statements. I feel like one thing I've been seeing on Facebook, everyone talking about smudging and using that, and we use it in our home and our family to clean the air. We've been using it, but then also I'm worried about the cultural appropriation of outside folks of like, this is a critical medicine that we're using. If folks are saying, oh, the Indians are doing it, we should all do it too. So I want to like put that out there to folks that are watching, is like also be mindful that these are sacred medicines that communities rely upon. And if they go out and they're not there anymore because all the outside non-natives are using them, that's an issue. And I think that's a valid issue and valid concern that a lot of communities have. I want to, before back over to Stacy, I want to ask Linda if you have any other comment you want to, based on what Nicole has shared here.
So I really appreciate what Nicole was sharing, and I want to make sure that everyone is following their protocols, the protocols that were put in place by their elders, whether they're collecting food or they're collecting medicine, or even when you're using that, follow the protocols put in place by your people, because the protocols that were put in place by your tribe are probably different than the ones that are put in place by mine. So make sure to follow those, make sure to sing the songs and say the prayers, because that all helps too. And I think it is important to stay calm and to not panic, because of course, stress and anxiety will lower our immune system. And so it's important to I think that's another reason to smudge as well, is that, it makes me feel better. And I think, that's really important as well. So I also wanted to reiterate what you were saying about being careful, being with our elders and with our knowledge holders. I can think of a particular elder who has been called on, and people want to see him and people want to hug him and people, want personal consultations, and he's in his 70s. And, I prefer us to really give our elders their space and only talk to them over the phone so that we're not putting them at risk. I also just want to say, make sure that everyone knows that how important staying healthy and eating right and avoiding inflammatory foods like sugar and dairy and even gluten, wheat products, how important that is right now. Not relying on mac and fry bread, but relying on traditional foods is really important, because in the research on other coronaviruses, having a really healthy gut microbiome, I just can't stress that enough. It's found to be really important in fighting coronaviruses. So eat right, eat your probiotics, eat your traditional probiotics. You know, if you're Ojibwe, you have maple vinegar. If you're Lakota and Dakota, you have Wojapi. And many other tribes have other, you know, traditional probiotics as well. So rely on that stuff, rely on the medicines, rely on the foods.
I think that, you know, it's something, it's just a thought I've been thinking of. And then it's one of those things that I'm like, I'm nervous to say, but this crisis, this pandemic, I feel like it really has demonstrated what you already said. Like this has been prophesized, that we need to get back to our old ways, that we need to protect our traditional ways of life, our teachings, our original instructions. We have to cherish them, but also continue them. And this is a prime example where folks are realizing, oh, this system is very fragile that we're a part of. And, you know, we're seeing that fragility right now, and it's putting us in a situation to where we're like really nervous and anxious. And I've noticed that I got cousins who are like, you know, they still hunt or they live off the land, where I notice their anxiety is a little bit less, because they're like, you know, we're able to provide for ourselves, and we're relying on our original instructions to help us get through this moment. And ceremony and prayer is very much a part of that. And I know that's not, I'm saying that, I'm advocating for us to do that return, while also recognizing that half of Native peoples in so-called United States live in urban areas, and it's a challenge. And so I recognize that, but I also want to acknowledge the fact that it's a matter, I think really this moment is showing us a necessity to return to the land and to establish a relationship with the land itself. So thank you very much for that insight. I want to go over to Stacy. Stacy, I just heard that there's 200 Corps officers who work with the IHS system. The Corps officers help provide support and assistance to a lot of IHS, Indian Health Service hospitals across the country, but 200 of them are being pulled out of IHS offices or hospitals and being sent to coronavirus hotspots. What is that causing? What's the cause? What is that causing? What's the effect, or what's the effect of that going to be? And what's your concerns around, you know, us moving and taking out these, you know, people that are supposed to be helping our local hospitals and sending them elsewhere?
Well, as you can imagine, it's really disappointing. The tribal leaders were very clear that, you know, when the Ebola crisis broke out in Africa, their tribal leaders were clear then, please don't send any of our physicians to Africa. We need them here. And that happened at that time. And now we have had tribal leaders make the same outcry to have those public health uniformed service officers stay here, and that wasn't heeded. I mean, we have areas where there's a 40% vacancy rate for healthcare providers in Indian country. This is not the time to be sending our doctors or health professionals or experts off reservation. And there's another thing that's just vexing me a bit. People are using the term hotspot, but if there's not availability of testing and there's not availability to get those tests measured and read, how do you even know where a hotspot is? Because we don't have the surveillance in place that we need to have in place to know that. And that's not just Indian country, that's the whole country. So that's just, I think that we have to make the assumption that we're living in a hotspot, and the physicians should be staying right where they are if they are supposed to be serving Indian country. That is the trust responsibility. That is the sacred obligation of the federal government. That's what we negotiated for. That's what we fought for, died for, and are on reservations for, and living in the post-colonial status that we're living in, so that we could have something as simple as physicians who would be on the reservation, not to have them taken away when we need them the most. And when you're talking about vulnerable populations and the statistics around those who are the most vulnerable, yes, it's our elders. It's also people with diabetes, cardiovascular disease, cardiovascular compromised systems, immunocompromised systems. If you put that profile up, that's Indian country. So the most vulnerable people and the first people of this country should not remain less an opportunity. It's very frustrating.
I think that when I was learning about, who are at most risk, you listed off all those things. I'm like, yeah, that's my cousins, that's my aunties, that's my uncles. That's like entire communities are in the the danger zone for what we're dealing with. I want to say thank you. I'm going to take a pause here. Just say, folks that are watching, please share this. We still have some time left here with our guest panelists here. This is being put together by Indigenous Rising Media to have an informed conversation around COVID-19 and how we are responding to that within Indian country, and how are we supporting our communities and families to get through this moment. So if you have questions, leave them in the chat your questions, and pretty soon here we're going to start fielding some of the questions here. My coworker Jennifer Falcon is monitoring the chat feed and will kind of help us process some of these right now. Nicole and Linda, this is for either one of you. I'm gonna ask a silly question, but obviously it needs to be said for some people, is why are we socially distancing? What is the purpose of it? I should have started the whole conversation off with that, but we'll go to Nicole. Like, really kind of break it down for folks to help understand, even for those, whether you're in Chicago or LA or Oakland, or if you're out in the middle of Montana, what's the purpose of social distancing?
It's one of the most important points of this fight against this virus. And I heard an interesting story from an elder on another presentation where they talked about how in the wintertime, especially where I am, a lot of families went out in isolation on the land. And one of the protective parts about that is they were actually separating themselves from large groups when some of those bugs tended to go around in the cold weather. And one of the concerns is that if we're within 2 meters of another person, and they are coughing or sneezing or otherwise, there is a much higher risk of us breathing in those particles or being exposed to that virus that we're talking about today, SARS-CoV-2. When we're able to keep ourselves away, we reduce that risk. The other main issue is that so far the data is showing that up to 50% of infections are asymptomatic. And what that means is that somebody actually has the virus, but they don't have any symptoms whatsoever. There was no stuffy nose, there was no sore throat, nor cough. And they, however, are able to still pass on that virus to other members of the community. This is a huge issue, and it's one of the reasons why it is so important for our young people in particular to take this guidance of social distancing and make sure that you are staying away from others. I know it's very hard when you feel good and you feel healthy, and sometimes because you feel good, you think that there's no risk. But because of this information that we're getting, it means that you are putting at risk many other people around you if you're not actually abiding by some of these guidelines. So I strongly encourage people, this is one of the most crucial things that we could do at this point of time in the infection. And it's one of the thoughts why Italy is being hit so hard right now, is because they didn't start the social distancing process soon enough like China did.
I want to, I see this statement going around a lot. I want to open this up to any three of you to give comment to, but I see a lot of people referencing saying, our people have been through worse. Our people have experienced this epidemic before. We've been through smallpox. And for me, it actually bothers me, that kind of referencing, and almost as though this isn't serious. This is not a serious issue. Does anyone here want to provide a comment to that?
Well, I'll just say that if you read accounts from people in Italy, and there was a reporter who asked people in Italy to say, if you could go back to yourself 10 days ago, what would you say to yourself now? And almost all of them said, stay inside, stay away from people. You're not taking this seriously enough. I do see that happening, and it is frustrating to see that happening in our Indigenous communities. you know, oh, we've been through worse. Yes, we have been through a lot, and we are resilient, and we've come through so many pandemics and things like that. But smallpox is a horrible example. It wiped out a massive portion of our population. So that's a horrible example to use. I don't want us to just get through this and you know, have like 10% of our population survive. I want us to thrive through this, like Mother Earth is doing, right? You know, she's cleansing herself right now. A lot of, you know, if you look at the maps from China and Italy, the rates of pollution have gone down so much. Okay, well, let's stay inside and distance ourselves from other people. If we get outside to maybe to get some fresh air, exercise, get out in the sun, still stay away from people, let Mother Earth heal herself, and stay away from elders. I mean, it's just, you know, stay away from everybody. It's not a whole lot to ask. And this is traditional for our people. I feel it's totally traditional for all of, I come from multiple cultures, and it's very traditional for us to distance ourselves, especially this time of year when it's so easy to pass viruses and even bacteria to others. So stay inside, distance yourself from others. It's if people get sick because of you, it's your responsibility. If they are hurting because of you and you've passed that on to them because you haven't distanced yourself, it's your responsibility. And I personally don't want that on my shoulders. So yeah. We are definitely quarantining ourselves.
Anyone else want to give comment?
I would really like to, if you don't mind. You know, one of the things that we're hearing is that people are re-experiencing trauma around the fact that this pandemic is in the world, and it's around the world, and it's in our communities. Today, we learned that the first individual in Oklahoma to die from this disease is a citizen of the Cherokee Nation. This is not a maybe thing. This is a real thing. And I love that our people are so resilient that they have a positive attitude about what this might mean. And yes, we've been through worse, but it's not a race to the bottom. I mean, we need to be on this planet. We need to thrive and survive and give the vibrant gifts that the Creator has given us to give. And the guidance is there. Our medicine people are there for us. And I love when Nicole said we have to take care of them as much as they take care of us. And Linda had made that point as well. That's really compelling. But I think we need to have some sensitivity to the historical trauma factor around another pandemic coming to our people, and have some grace with each other for how frightening that can be.
Yeah. The potential for loss of life is very high. And particularly for those that have compromised immune systems and our older relatives. Stacy, you had mentioned earlier on the call that, you know, the federal government, Congress, is right now negotiating a series of packages to help boost the economy and help folks on the ground, but also help healthcare providers, healthcare workers do their job to stem the tide, you know, to flatten the curve. Indian country needs a lot of resources, and you have mentioned that the National Indian Health Board, as well as I know other organizations, NCAI, a couple other organizations who are involved, to really pushing hard on congressional leaders to make sure to get the resources to Indian country. What can people do? Or actually, let's do it two parts. What ask do you have, if any, of tribal leaders to support the National Indian Health Board and other organizations in that effort, and what can common Native citizens do as well?
Thank you for that. First of all, tribal leaders are really under a lot of pressure right now too, as other levels of government around the country are closing their doors or trying to practice social distancing as well. So I would ask that we keep our tribal leaders in our prayers. They have a heavy, heavy burden to carry for being responsible for all of their people. And I would ask tribal leaders to just please remain in contact with us at the National Indian Health Board. Please tell us what's going on. We're doing a series of surveying to find out, like we found out that 90% of the tribes have not received any personal protective equipment. you know, that surveying, that kind of information informs policy. It pushes policy forward. When we can get the whole picture, we can tell the whole story. It's much more compelling than anecdotal information. And thanks to tribal leadership and tribal health directors responding to our surveys, we have our fingers on the pulse. Participate in the webinars that we're putting on. We had one with an infectious disease specialist from the CDC earlier this week. As I said, there were 1,100 people on that call. And, you know, just be engaged in ways that you can and give us your best thinking for your people so that we can carry your water in a good way up here. The other thing is, write to your members of Congress. We're all indoors. For those who have the internet, send an email, but communicate with your members of Congress and communicate with your local health officials too. I was on a call today with the White House that was a state, tribal, local government call. They were talking about $64 billion and how that was going to be distributed. And I was really, really, really honored that I had the chance to say, well, don't forget that that could also be distributed to the tribes. And we need to collaborate and be helpful in that way as well. So your voice matters. The things are moving quickly, but just keep your stories coming, keep engaging. We are launching a national COVID Tribal Resource Center on our website, www.nhb.org. That's going to have a lot of different resources, and particularly in advocacy. We're trying to make that happen for the tribes.
Thank you so much for that, Stacy. So we encourage folks to heed that call if you can, if you're able to, if you're in tribal leadership position, or if you're just a citizen of your nation and you need to want to help some way, there's some ways, there's some good guidance there. You can also, I'm sure you can go to National Indian Health Board, follow them, check out the website and get more information. So we're gonna go to the questions. If you have a question, ask it and leave it in the chat. And Jennifer, my coworker, is gonna be monitoring it and giving us feedback here. There is a series of questions, actually a lot of comments and questions about dealing with the symptoms, and the questions around elderberry and ibuprofen. And people are going back and forth, talking about how elderberry is helpful. Some folks are saying just ibuprofen. Some folks don't know. So what is the answer? What is a couple answers or responses to that, Nicole and Linda?
Yeah, so there was some reports out of France that ibuprofen might be causing problems. There is actually no hard data to be able to corroborate this. Where it came from is that certain children who have the flu, who take ibuprofen, are at higher risk of developing something called Ray's syndrome, which is a neurological reaction to the virus with that medication. So it's kind of been transposed as a caution over to SARS-CoV-2 in the event of. So based on this point in time, because we don't have a lot of good evidence, the recommendations are to stick to acetaminophen, which is Tylenol, as opposed to ibuprofen if at all possible. And again, this is not based on hard data. That needs to be clear. It is based on some circumstantial evidence and some fairly vague recommendations at this point in time. The elderberry discussion has been ongoing, and the main reason why it came up is that elderberry has beneficial antiviral properties. There was concern from some folks that because SARS-CoV-2 or COVID-19 disease presentation often causes a type of inflammatory reaction, or what's called a cytokine storm, and that elderberry may be actually precipitating or encouraging this reaction. I've been over the literature in many chat rooms, discussions with many naturopathic physicians who are basically saying that this is not the case, that you do not have to worry about this with elderberry or its products. So at this point in time, I have absolutely no concerns using elderberry with COVID-19 at this point in time. We have to remember that a lot of our medicines, even though they're powerful, they're also dilute in their various properties that they have. And if people are using them in their traditional ways under their traditional people, I trust the way that those people are making those recommendations for their community members. They are knowledge keepers within this, and you know, I think we need to listen to them, but there's evidence backing up some of those decisions too.
Thanks, Nicole. Yeah, I just want to reiterate that the study that a lot of people are citing was with 12 people, and it was a very incredibly strong elderberry extract, pure extract, not mixed with other traditional medicines like honey and star anise and cinnamon and clove, like we're all recommending. They weren't using it in conjunction with other antivirals that we've all been recommending, such as olive leaf, St. John's wort, cedar, and I recognize that some people do not drink cedar tea. I want to make that clear, but some people do. So I think that's really important to remember, is that, you know, elderberry is used as an antiviral. If you have concerns, it's, you know, use this really sacred, amazing antiviral that has been used by our people for so long. But if you have concerns or you have an autoimmune disease, at the first sign of illness, you can quit taking it if that's a concern for you. But just to put out there, I myself am taking elderberry every day, and my family is as well, my children. So it's a medicine that I trust, but it's only one of a number of antivirals that we're using.
Thank you for those responses so far. And folks, there's more questions here. We plan to schedule this for an hour, so we're coming to the top of that hour. Just wanted, I'm so happy to have you three on this call and doing the work that you're doing. It's amazing. Stacy, I'm gonna ask you a question. Maybe Nicole, you can also, or actually all three of you someone might be able to chime in, but it's a really simple question. And is Indian country prepared for this pandemic? Is it, and if not, like, how close are we to being prepared in your own estimation? What needs to happen for us to be prepared?
I don't believe that we are prepared. I believe that our country as a whole is also not prepared. I believe that the incredible work that's being done to bring resources into the Indian health system is critical and vital to bringing us to a place of preparation. $1.5 billion would be very helpful. A couple of the things that are unique to our communities, it's been mentioned earlier, homelessness is anathema to our people. So we'll have a house with 2 bedrooms and 1 bathroom with 3 families living there. It's impossible to do social distancing when you have that kind of situation. You have to have some kind of, we need some kind of places where people can go for ICU beds, which we don't have. Our hospitals are 40 years old in the Indian health system. You know, tribes have done a tremendous job, like the Alaska Native Medical Center, the Choctaws, Chickasaws, my own tribe, building our own facilities and so forth. But in the Indian health system for the direct service tribes, the equipment is 2 times older than it is in any other place. The hospitals are old. There are only surgical units in 50%, and the IHS clinics can't read the virus test. So we're not prepared. Having Indian country have access to the national strategic stockpile would be a tremendous step in the right direction. Having access to the CDC's emergency resources, which the tribes legally do not have access to, that would be great too.
Can I pause right there? The strategic national stockpile, which is a stockpile of medical supplies that they set aside for emergencies like this. Your tribes don't have access to that?
No, we do not. And Elizabeth Warren has just introduced legislation in the Senate that would get us access to that. And we don't have it. And we tried to correct this. We've been trying to correct it for a long time. And of course, sometimes an emergency is just what you need to get these structural things handled that are really quite ridiculous. But no, the tribes currently do not have access.
Wow. I think all of us can say we're not surprised, but it's still surprising and appalling. Thank you.
We're working on it.
Yeah.
We're working on it.
Anyone else want to chime into that question of, are we prepared, and what do we need to do to be prepared, given that we're preparing for something that's happening right now?
So I'll just say one thing about that. On one hand, I feel like we are completely unprepared from I think from a greater medical perspective. But on the other hand, I feel like no one is more prepared than Indigenous people to face this, because we do still have our traditional medicines, where we still have you know, a relationship with our traditional medicines. We still have a relationship with the land. You know, we're hunters, we're foragers. You know, we garden. We have seeds that we've been saving, and I know so many of my relatives do. So I feel like, you know, no one is really more prepared than we are in that sense. So, you know, and we don't worry about toilet paper quite as much because we're resourceful, right? But you know, so from that perspective, I feel like no one really, you know, has a leg up on us. But we have to remember our Indigenous brothers and sisters who are in urban communities. I am not in an urban community, and so I feel like I'm a lot. I feel confident, actually. So one of the things I've been doing is trying to spread that confidence to others, and just telling them, remember what we have. We have a gift that I feel like perhaps the non-Indigenous community does not have. And we need to remember that and be confident in it, and put a lot of our trust in that knowledge.
I have a question, and it's another one I've seen going around a lot. But Sweat Lodge Sandwich, just go into sweat and he'll burn it out. What do you have to say to that? And for folks that don't know, it's just a sweat lodge. So, what are the responses to this? What I'm seeing the people going around, that's all you got to do, and that will take care of it. Nicole?
Yeah. So the you know, sweats, most of them, you know, will remain a temperature of about 120 Fahrenheit for the duration of the sweat, depending on what I've seen from some of the coronavirus data in particular. We don't have a lot on SARS-CoV-2, but we do have it on some of the other viruses, is that they may actually survive up to 132 Fahrenheit. And because they're spread through airborne droplets, you know, it may be a difficult for one. However, having said that, there are often a lot of medicines that are used during sweats on the grandfather rocks that do provide additional spiritual action within those. So, you know, for me, it's really going to be a matter of the traditional person, because I do trust their particular judgment and how they're running their ceremony and their sweat to determine whether or not it's appropriate. You know, I think we just got to avoid pressuring our sweat lodge holders to host them, because that could put them at risk as well. So it's a very difficult question, but I think it's not as easy as just a yes or no at this point in time, given some of the other coronavirus behavior in even high temperatures.
I'm gonna step out of my impartial stance here, and I would encourage folks not to do it, just because, like you said, like the spiritual leader may not have it, and you're putting them at risk of making them sick. And also, the hot temperature may affect whatever's in the air, but if it's already inside you, you're not really going to cook that bad boy out with a sweat lodge necessarily. So just encourage folks, my own humble opinion, you know, just smudge to yourself. There you go.
Definitely be cautious.
Right. I got criticized the other day, actually, because I did not want to share a pipe with 30 other people. And I was talking about that on Facebook, actually. And, you know, it's not that I don't have faith. I feel like, you know, I have deep faith in prayer, but I'm also a scientist. And so I feel like, you know, the Creator has given us knowledge, and sharing a pipe with 30 other people at this time probably is not something that I even think the Creator would recommend. So yeah, I personally feel like stay at home, pray at home, go into a sweat alone if you want to, and pray for the people. But remember that if you're asking someone to run a sweat, you're asking them to put themselves at risk.
Exactly. We're going to be coming to the end here. And I want to take a moment to recognize the fact that we are advocating for people to stay home. We're strongly advocating for people to practice social distancing to protect not only their families and themselves, but also protect elders in their community, or even elders they don't even know, or people that have who have compromised immune systems. We don't want to be contributing to the virus that's potentially could kill folks or extremely harm them or debilitate them in any way. But we also, I want to send love and appreciation to those who are on the front lines and healthcare workers who are fighting this. The folks the doctors and the nurses, the ambulance drivers, the people who are putting their lives on the line to support the folks who are going through this moment. And also I want to recognize the public sector, the public service workers who in our cities primarily, who are still going to their job to make sure that we have water, that we have the garbage is being taken, that sanitation is being met. These are folks who are doing are heroes in their own way. And I also want to recognize relatives out there who are like, migrant farm workers and people who are actually working to make sure that our foods are still being provided in this country, who don't have a choice as well. There's a lot of relatives in a lot of predominantly low income communities who really don't have a choice, who are trying to make it work. And so, we want to recognize those who are risking their lives because they may not have a choice, or who are doing it for a higher purpose to serve their community. And we want to recognize those who are heeding the warnings and doing their best to socially distance. And with that in mind, I want to recognize the fact that there's a good chance that the majority of people you see on screen here are wearing sweatpants right now. Business on top, casual but down below. That's the name of the game nowadays, and we're all playing our part. I want to ask for any parting words from you all as we close this out, and anything you want to share, any other resources that people can go to find more information, not only about the work that you're doing, but resources that might help them answer some of their questions around COVID-19 and how we mitigate this pandemic. I'll go over to Stacy first here.
Thank you. I want to do a shout out too to the community health representatives. We have unique healthcare providers in our community who are on the front lines, and they're the ones who will come to your home and help you with medications and diabetes screenings and so forth. I think that in the coming weeks and days, we're going to find these people absolutely indispensable, and we need to get them personal protective equipment so they can continue that work. And I just want to say thank you to those people, Miigwech, in advance. I think they're unsung heroes in the Indian health system who do a tremendous service for our people, them and CHAPS, and let's keep them in mind. And thank you.
Linda?
I just want to give a shout out actually to a lot of our Indigenous brothers and sisters who are losing their businesses. They're out of work. They have had all of their events and speaking engagements and everything canceled. Classes canceled, workshops canceled. My friend Kim Tilson Braveheart with Etiquette Catering down in Rapid City, a lot of us are ordering food out. We're ordering pizza and things like that. Why not order from people like Kim with Etiquette Catering, or the sous chef if you're in the Minneapolis area, or try to support our Indigenous farmers who have been trying to sell their products, like Sakari Farms, my friend Spring Alaska up in Oregon. Let's try to support our Indigenous businesses right now, especially because a lot of them are seeing it hard. And actually, I know some of them have already lost and shut down their businesses. So let's try to figure out who they are and support them and give them love right now. And yeah, thanks guys. Much love.
Nicole?
Masi Cho, I think, throughout all of these changing times for, a lot of us, and we're going to have some challenges ahead, but I think as long as we remember that we're a community all around the world. It's not only here in the US or above the medicine line in Canada, it's our Indigenous brothers and sisters in every single continent around this globe who are facing the same challenge that we are here. And I think collectively, if we bring our energy together, it can be very powerful in that. And to think about that during your prayers and your ceremonies, the amount of powerful Indigenous energy that we have around this globe including our plants and our medicines and our animals and all of those supports that we have in place to be able to get through this. We are extremely resilient. We have to be smart resilient through this, which means that we do need to bridge both worlds, use that two-eyed seeing approach that Mi'kmaq elder Albert Marshall talks about, where we can use our one eye for our traditional knowledge systems and then our other eye for some of this public health information like social distancing and otherwise, and be able to bridge those two worlds together to become very powerful for our communities, to put our communities first by staying away from them, but at the same time being ensuring that we're giving back. If you know somebody in need, give to them. You know, our communities always need help, and as much as we can to work together, I think we're going to be stronger through this, no matter the hardships that we face coming.
Thank you very much. There's one thing someone reminded me to mention here, because I know there are native construction companies out there. If you know somebody that runs a native construction company, construction companies tend to have N95 respirator masks. Those masks can be used by hospitals. So if you are you have a construction company, or you know somebody that does, the mask that they use, the N95 mask, can be given to IHS. It can be brought to your local hospitals to help support. So I want to help spread that. See a little one there. And I want to end this with these words, parting words, I know some of us, you feel alone. You're isolated. You're sitting in a home. You might be next to your significant other, and you're like, we don't spend this much time to each other, and I don't know if I can last that much longer. That may be you. It may not be you. You know, you might be challenged because you've never had to spend that much time with your kids during the day. And now you're finding this unique opportunity to say, how am I going to do my work and feed and do all these things? That may be you, that may not be you. And whatever it may be, this is a moment, not just for your tribe, not just for Native peoples across the world, not just for people in so-called United States. This is a moment that the entire world is sharing right now. We're going through a moment that is literally going to change history. That is where we're at right now. You're not alone. Not anyone is alone in this moment. And so there's a chance for us to really come together, to build community, to have a good time as much as we can, given the circumstances, and to enjoy a break from all that craziness that is the modern world. A break from us going out and dealing with traffic, a break from us interacting with people we don't necessarily want to interact with, but we have to sometimes. A break for us just to be one with our families, with those around us. And if you happen to live in an area where you can go outside and be in the land, a chance for you just to enjoy that moment. I think sometimes as an organizer, I feel like I have to go. I have to do this, and I feel anxious, but maybe there's an opportunity for me just to settle down and just to be present in this moment. Maybe that's something that is a gift out of this moment. And also, Linda, you touched upon this. This is a moment that Mother Earth hasn't gotten for a couple hundred years, where we step back and nature is running its course. A moment for Mother Earth to show us that power, where we're seeing clear air. We're seeing waterways are much more clear because we're not polluting them. So let's celebrate that moment. That's a moment to be together in this as community, as family and loved ones. And we know we will get through this. So thank you, each and every one of you. Thank you, Nicole. Thank you, Linda. Thank you, Stacy. Thank you to the institutions that you are a part of, the organizations, the groups, the chat groups, all that work that's happening for making this a fulfilling moment for me and for all those watching. Facebook, you can follow these folks. They're on Facebook, they're on Instagram, so you can check them out. And we'll be back. Indigenous Rising Media, we're going to be following up with a couple other conversations. We want to have a conversation with tribal leaders to see how the unique positions that they're in and the challenges they're facing. We also want to potentially talk to some other medical professionals who are doing some great work out there, and continue this conversation onward. So thank you very much. We're going to end there. Thank you, Jennifer Falcon, on the back end, our communications coordinator, for helping us out. See you all later. Doksha Ake, Wachim Kapite.
See you guys.